I'm your host, Davida Shensky, and you're listening to Live Without Limits, Reach Personal Success on a Daily Basis. We talk about mental health issues, personal growth, personal development, relationships, and anything that pertains to your mindset and can affect how you reach your goals or achieve success in your lifetime. And today's presentation is titled Trauma Survival: Why Body Based Therapy is Essential. When many people think of trauma survivors, they think of combat veterans, victims of abuse, sexual violence, physical injury, or those who have survived life threatening circumstances. These kinds of experiences are also most commonly associated with post traumatic stress disorder or PTSD. These are sometimes referred to as the big traumas. However, there are actually many more trauma survivors that fall the little t trauma category. Essentially, little t trauma would be any distressing experience or event that one considers traumatic, such as living in a chronic, stressful environment, feeling unsafe, which is an environment that I grew up in for many years. It was very stressful, and today I'm on blood pressure medication simply because of what I went through as a child with a disability. An injury, not life threatening, but still traumatic, being bullied. And that's another thing that I experienced simply because I was different and there was no one like me in the classroom because at that time there were no laws that guaranteed people with disabilities the right to an education, and most people never knew what a disability is or how to relate to someone with a disability. Experiencing loss, people and pets, witnessing something traumatic can happen to policemen, firemen, paramedics, job loss, relationship breakup or divorce, other personal stressors. As the understanding of trauma advances, more and more professionals are refusing to overlook the reality that multiple little t traumas accumulated over time can lead to PTSD, leaving people with subpar emotional functioning. In fact, the newer sciences are addressing it nicely. Are you a trauma survivor? Most people admit to experiencing a series of little t traumas over the span of their lives. Others have experienced both big and little t traumas. I think it's safe to say we are all trauma survivors or on some level or another. Of course, the severity, duration, and type of trauma comes into play when it comes to how we navigate life mentally, emotionally, socially, behaviorally, and more. For the sake of this presentation, let's just assume that most people have dealt with little t traumas. Some have dealt with the big T trauma, and some have experienced both. What is body based therapy? Traditional therapy is well known among the public, and many people seek out a counselor when they're going through a rough patch in life. One of the most common therapies offered is cognitive behavioral therapy, or CBT. It's truly a wonderful healing modality. CBT can help patients learn to identify thoughts, belief patterns, or behaviors that haven't been serving them well. Then they can work on changing those to more positive thoughts, beliefs, and behaviors. Essentially, it follows the what you think and feel influences your behavior model. But for trauma survivors, especially the big T, CBT doesn't usually go deep enough to heal the patient at the body or emotional levels. You see, when you experience something traumatic, it doesn't just affect your thoughts, it also affects you at the body or an energetic level. Body based therapies work with you at the body or emotional level, helping you release any stored trauma. How does trauma affect the body? Well, Dr. Peter Levine, who first introduced somatic, which is body experiencing, says that when humans experience something traumatic, the big T and the little t, the nervous system puts you in the fight, flight, or freeze survival mode, for it wants you to survive. For example, let's say you're in the woods and you come across a perceived poisonous snake on the path that is moving your way. Your nervous system is on it, immediately causing you to go into survival mode, signaling you to fight, flee, or freeze. Freezing gives you a few moments to decide your best action for survival. At the same time, your body is releasing a cocktail of stress hormones to assist you no matter what you decide to do, such as adrenaline, cortisol, and norepinephrine. Let's say you run away and get to a safe space. Shoo, you dodged a snake bite. You take a deep breath and your body starts to calm down. It automatically knows how to release the burst of energy that was needed to get away. Oftentimes, after something threatening happens, the body will cause you to shake, cry, or yawn to release any excess energy, trapped trauma energy. But what about trauma that doesn't get released? What happens to them? It's stored in your body, and down the road, it can lead to mental, emotional, or physical issues. This is why body based therapies for trauma survivors are so important. Many times when we are experiencing something traumatic, we don't release the energy or emotions. We repress, reject, numb out, disconnect, or shut down those emotions. This is especially true for babies, toddlers, and children whose nervous system just aren't strong enough to fully process and release trauma. For those who grow up in homes that are volatile, unsafe, or abusive, the children essentially live in chronic survival mode with a dysregulated nervous system. And though they may be functioning all right day to day, that stored trauma doesn't just go away. It will progressively lead them to feeling mental, emotional, and physical pain until that stored trauma is released. Hopefully, you're more curious about body based therapies for healing trauma or symptoms of PTSD. You see, at the brain level, we are always processing information, forming what we called implicit and explicit memories. Explicit memories are the facts and are typically processed and filed away nicely. Explicit memories are body sensations and emotional responses. That's our feelings. Explicit memories are the facts and are typically processed and filed away nicely. Implicit memories are body sensations and emotional responses, and that's our feelings. Both types of memories must be integrated for healthy processing and optimal living. However, under stress, the brain isn't concerned with helping you process and file your feelings. It's not caring much about remembering things at that time. Rather, it sends you right into survival mode, providing you with energy to fight, flee, or freeze. And when that happens, the memory goes without getting processed, which is why many trauma survivors have gaps in memory. But the emotions are still there, stored in your physical body, and they don't want to stay there. If you can release that energy at that time, great. But if you can't, for whatever reason, that energy can just get stuck. Body based therapies are a branch of somatic psychology. Essentially, the concept is that we all experience life through thoughts and emotions, but at the same time, the body too, exploring these experiential types of therapy can help you discover what's going on at the body or emotional level. A therapist can help you see if you've gotten stuck in the fight, flight, or freeze mode and help you release stored trauma energy. The result, you'll experience fewer negative emotions like anxiety, depression, or fear. You will learn how to better regulate your nervous system. You will learn to feel your emotions without freaking out rather than stay disconnected, shut down, frozen, or repressed. You'll learn how to listen to your body. You'll learn to become more mindful, being fully present. Examples of body based therapies include somatic experiencing, EMDR, accelerated experience dramatic psychotherapy, or AEDP, Gestalt therapy, expressive arts therapy, dance therapy, neurofeedback. We are all survivors. And this is, I think, something that is so important to remember. No doubt that we are all survivors of trauma in some form or fashion. However, if you're struggling with things like depression, anxiety, intense fear, shame, dysfunctional relationships, get to know your options when it comes to therapy. Talk therapy is wonderful, but so are the body based therapy modalities. If you are a trauma survivor interested in exploring body based therapy, do some more research on the topic. If you're actively seeking a somatic therapist, look for a licensed mental health professional that has advanced training in body based somatic therapy techniques. May you continue to heal in your mind, body, and spirit. Also, there are quite a few different types of modalities that have been around really since the 60s in the 20th century, when there was a big outgrowth of the self help industry. And some of those are psychodrama, where you get to act out a scene from a traumatic experience so that you learn how to express those feelings and emotions that you had at that moment and overcome them. And then there's also transactional analysis. We know about the laws of attraction that talks about how affirmations can help turn you around. Well, in TA, you've got the parent who says you should, you've got the adult who says I'm able to, and you have the child that says I want. And when you look at the and finish up those sentences, that's when you can see where your conflicts are and how to work on them.